Why did you choose this course?
This course, or rather this path, serves to respond to a specific need expressed by the local emergency operators. And at this point, one wonders, what is the operator's fear?
I would definitely say an obstetric emergency, not only from a clinical perspective, but also from an emotional and psychological point of view. And so, how can we achieve this goal?
The goal is a method goal, a working method that strengthens technical skills but above all introduces and enhances soft skills, that is, team working, through and thanks to the effectiveness of the CRM philosophy, which we have imported from aviation.
Enjoy the rest of your working day.
Thank you.
Let's listen to what our colleagues in the emergency services think. Since when we became a part of the emergency services system, we have strongly felt the need to revise our knowledge within the obstetric field, as our official education regarding the matter is not treated in an adequate and constructive manner. After coming into contact with SIMANNU and the efficient world of simulation, we asked if it were possible to design a tailored course led by experts such as gynecologists, obstetricians, and intensive care specialists in order to develop our understanding and necessary practical skills.
For us, it was important to listen to our colleagues and learn about their experiences in this area and during the transportation of patients by ambulance. We received a very strong and clear request to be able to have all the suggestions and cognitive tools necessary to be proactive. We were asked to help prepare the necessary equipment in the local structures or in the ambulance, medicines and materials, to deal with some types of emergencies. But above all, to have access to cognitive aids of extremely practical and easy consultation, such as mnemonic cards. These for diagnosis and therapeutic means. The topics covered were pre-eclampsia, postpartum hemorrhage, and precipitous delivery. Another requirement was the psychological reassurance of our colleagues in the workplace. The concept emerged that some unavoidable events that arise in everyday life cannot always be resolved with the few means available, but require dedicated structures and operators. The selected emergencies were all tested in the workshop, in simulation and discussed during the post-scenario debriefing. Especially during the workshops, a fundamental path has really been developed to allow the structured organisation of the material and human resources necessary to enable them to make the correct diagnosis and help them in a purely practical terms to package it from a pharmacological point of view. A suitable kit inside their backpacks. An example was hemorrhaging, where the path allowed the structure of a new checklist associated with clinical mnemonics to optimize diagnosis and treatment in full run and play perspective. I'm used to working in an airplane cockpit rather than sitting in an ambulance. However, from aviation I have learned how important it is to do training and simulation in an environment that offers an experience that is immersive and engaging. The performance of a group of professionals facing a critical situation is the result of their knowledge and experience, but also of the interaction with the equipment available, the medicines and the contents in which they operate. We decided to build some scenarios in a real ambulance to have the opportunity to observe the teamwork dynamics, how people interact with each other, exchange information, take decisions under stress, and how they use some cognitive tools such as checklists and mnemonics. And we discuss all these human factors in the debriefing. In aviation, there's a saying that goes, the best equipment on board is a well-trained, cohesive team.
Having profited from the inherent issues regarding giving birth and obstetric emergencies, we have radically modified our critical approach. For example, we have introduced laminated clinical mnemonics, which serve as a guide, amplifying the checklist of principles and medication which were once overlooked.
And here we are, And this is the result of our work. That in the end, the method we used and wanted to look for is what the good old Confucius said 2,500 years ago. If I listen,
I'll forget.
if I see,
I'll remember.
if I do,
I'll understand.
and now let's go to understand.